I am thrilled to be here with you all to celebrate the day, World Patient Safety Day. I am a director of the Better Birth Program at Ariadne Labs and have been fortunate to work for many years in Uttar Pradesh with several colleagues at the Community Empowerment Lab, as well as colleagues at the Ministry of Health and Family Welfare and among others. So I'm thrilled to be able to introduce our distinguished panelists, and I think we have a slide set up, and I just want to make sure that that's ready to go. So as mentioned by Dr. Lallu and others, we have a series of presentations that's going to take place over the next hour, and we hope to share with you learnings around the WHO Safe Childbirth Checklist implementation and the efforts that have been done globally, particularly in India, but also in the region and with colleagues in Sudan. So I'm just providing a brief bio for each person so we can get to the panel itself. So we'll have Dr. Vikram Datta, who will be joining us as he is the director and professor at Lady Hardinge Medical College in New Delhi, and also has done a lot of work with POCI, or Point of Care Quality Improvement, and you'll hear about his work. I'm actually going to turn next to Dr. Vikram Datta because elevating up out of the Safe Childbirth Checklist alone, there's this idea about quality improvement, and you have led Dr. Vikram on the POCI methods, which I'll let you define that in just a minute. And of course, you've seen successes and challenges in implementation. And I think one of the things I've loved about your work is that you've continued to champion this idea that we can make things better for women and newborns. So I'd love to understand from your perspective, what are the other complementary quality improvement capacities, initiatives, or interventions that are needed to accompany the Safe Childbirth Checklist to make it successful? So Dr. Vikram, I turn to you.
Thank you so much, Katherine. Good morning, good evening, and good afternoon to all the attendees. And thank you so much, Kaho, for inviting NQCN and me, especially to this session. Katherine, that is, I think, one of the toughest questions which you posed in the end. Well, that deals with the implementation science. And as all of us know, quality improvement is a science which comes from the heart. It is not a science, but it is something which requires a compassionate heart. It requires a receptive environment. It requires a supportive health system. And it requires a lot of skills related to the psychology of change being inbuilt into the health system. Now, to simplify it for most of the participants who are here today, the most important part I would say is, I would just tell you the pluses in our country first. In 2017, Government of India launched the Lakshya initiative, which was the Labor Room Quality Improvement Initiative. At NQCN, we happened to be leading the National Mentoring Group for Lakshya, which was a core group consisting of some quality improvement volunteers who decided to introduce quality improvement methodology into adoption of the rapid improvement cycles. I would just like to mention here that one of the short-term aims of the Lakshya program was 60% adoption of the Safe Childbirth Checklist. So from the very start, we had advocacy at the highest level from the ministries of health. That was one. We had a core group of volunteers who were dedicated, motivated, trained into QI to get it implemented across the country, starting from district, sub-district hospitals and the medical colleges to start with. When we embarked on the mission, it was more complex than we had envisaged, and it has all been published. The story has gone many times over into the BMJ. So what I just want to mention here is that we used something like translating research into practice platform, and this has just come up in the July edition of the BMJ. So we used the TRIP framework and we tried to adapt it. So in this, we mainly relied on point of care quality improvement methodology to bring about a two-way feedback system between the health care workers and the health system, which was practically non-existent before this. So that was one ancillary thing which we used. We also identified and nurtured change champions, because we believe that even if the system withdrew the support, these change champions, they're still connected to us because their agency has been deployed. And that is something which was very, very important. Apart from this, most of these setups where these checklists and the Lakshya program was, it came vertically up, top-down approach. There was no quality management system. So we tried to make them skilled into quality improvement methodology, at the same time giving them a taste of quality control, we tried to simplify the data management because it has 28 checkpoints. Now, expecting a district hospital or a sub-district hospital to fill in each and every delivery which is understaffed, all of these 28 checkpoints would be too far-fetched. So just adapting it, like all the other countries in the Southeast Asia region are mentioning, was something which is very, very important. And the last point, because of paucity of time, there are many points, but the last point which I would like to mention here is that we have launched a very vibrant communities of practice, which is maintaining the connect in the pandemic times when the physical connect has been lost. And initial intensive mentoring is something which is now continuing online, but at the same point of time, I would like to envisage here that if we want the health system to adopt using this, we should start right in the medical and the nursing schools, adopting it at a later stage. Like she said, the midwives picked it up much earlier and they were more compliant. The doctors were more stiff. This is going to be the case till we don't go back to the pre-service phase and it becomes a routine part of the curriculum. It gets ingrained into our healthcare system. So thank you so much, Katherine. I think that was a brief summary.
It's wonderful, Dr. Vikram. I think the call to action around the pre-service, not just in-service training, as well as thinking about the community's practice. I mean, there's a question about companionship and how is that included on the checklist, and whether or not a companion in the labor and delivery room could help encourage the use of the checklist or following the checklist. I'd love to hear if you have any final comments as we start to wrap up.
I would just like to mention here that the checklist has been made excellently well. It has been adapted by various countries and we've heard it in this distinguished panel. People had mixed reactions to its use adaptation. But from a quality improvement perspective, what I can just suggest to everybody is that it would need a sustained effort, a committed effort, and the presence and identification of a team of champions who could demonstrate the perceived benefits and making sure that the health system doesn't realize it as an added documentation. Because in LMIC settings, they already have in my medical college 29 registers. And if Dr. Hema would very well empathize with the nursing colleagues there and the obstetric residents, if we add up another 28-point checklist and Dr. Anuradha's setup, she's added another 40 to it. And my resident doctors are going to run away. So that is one. Second very important point is try to make it simple. Try to think about the Roberts diffusion of innovation model. There will be some innovators, 2.5%, they'll pick it up, whatever you may do, anything new. Another 13.5% early adopters. Now this will be your chunk of your people. And then the early majority is the one. So think about targeting the initial 50-51%. And if you have these many converts, I think you've achieved a critical mass, and slowly if you sustain, it's going to be there and it's going to sustain and it is going to spread with the support of the health system and the champions. So that is probably one of the ways in which we could implement it in the LMIC settings. Katherine, I'm sure this would be slightly different from how you would implement it in the developed world, but in the settings, and you've seen it in Uttar Pradesh, that this is how it's going to be implemented. So thank you so much for asking me for some suggestions. I'm myself learning it. I'm in no position to advise anything to this learned group, but definitely I think this is one of the suggestions. Thank you so much.
Wonderful, Dr. Vikram. And I just want to take a moment to say thank you so much to our expert panelists for joining in this wonderful discussion from around the world. Literally all time zones are covered right now. And I want to highlight that, of course, this dedication to World Patient Safety Day and your dedication to achieving safe and respectful childbirth and safe and maternal and newborn care is inspiring to me and the work that I do. But I believe that this panel has been helpful in identifying that it's not always an easy road, but it is definitely progress can be made. Again, I want to thank the leadership for inviting me and allowing me to moderate this panel. It's been really a wonderful experience. Namaste.
Thank you. Namaste.
Thank you so much, Dr. Katherine. Indeed, a wonderful session. You know, it's overwhelming to hear from so many experts across the globe and their experiences, the challenges. And from CAHO, as Dr. Anu said, we are the consortium of accredited healthcare organizations in India. We have excellent stakeholder base, quality professionals, doctors, nurses, administrators who are very passionate about quality and patient safety. So we are sold to the idea of promoting this safe child checklist. And this year we are going to be taking this as our agenda to motivate more and more hospitals join the journey, and we are very sure that we'll be able to promote this in a big way in this country. And as Dr. Anu said, our partnership is growing, and we'll be able to certainly have training sessions conducted across the country. We are really committed to what we are talking about today, and next year let's all meet together and see the success and where we time after 365 days, where have we gone? So that will be a good thing to look forward to. And thank you for sparing your time. Wonderful session. And thank you for all the panelists for sparing your time and your experiences.